Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Differential diagnosis. Differential diagnosis of a fibroid, polyp, and adenomyosis. Fibroid is present in reproductive age group at the age of 30 to 40 years of age. Fibroids are mostly asymptomatic. There is excessive bleeding is present. Regular bleeding may be present at the time of period also. Per vaginal examination. In per vaginal examination, there is enlarged uterus which is corresponding up to 20 weeks of gestation. These are asymmetrically enlarged, non-tender except in case of degenerations. First investigation in a fibroid is transvaginal ultrasonography. Investigation of choice for fibroids is transvaginal ultrasonography. Gross appearance depends on origin because in gross appearance it depends on origin and it originates from the myometrium. Differential diagnosis.
thank you and thank you for watching.